Hi, my name is Connie Ballone, and I'm the Chief Operating Officer for the Early Childhood and Family Learning Foundation. I'm here today to tell you a little bit about our programs that we provide for children in poverty in the city of New Orleans. We are a nonprofit foundation that was founded back in 2007 to help implement early childhood education in the Orleans Parish school systems post-Katrina. The mission of the foundation was 100% in, 100% out. Our goal was to have 100% of the children born into the community graduate from high school and move on to be successful in life, whether that means going to college, going to VOTEC school, or starting a family. The communities in which we work are the communities of Central City and Treme within New Orleans. These are two of the highest poverty communities in the country and definitely within New Orleans. Nationally, poverty rate is about 14%, and in New Orleans it's about 24%. In Treme, the poverty rate is 45%, and in Central City it is 38%. These communities also have populations that are highly undereducated. In Central City, over 30% of the adults don't finish high school, and in Treme and Iberville, it's 31%. Nationally, that's about 15%, so that's double the rate of people who don't finish high school nationally. Over the past 3 years, the foundation has provided services for 9,500 children in 12 schools in Orleans Parish. Through our programming, we are expanding capacity in the classroom and changing the culture for the children in Orleans Parish. Our model is based on Maslow's hierarchy of needs, which states that we need to nurture and meet the needs of the whole child and not just the academic child. We try to embed these services within the school system, within the school, so that they're available to the child where the child is every day. We try to involve the parents. They are a key part of this process, and we also try to involve the community. We want to ensure that the school owns the child and that the children that have these different needs don't get shuffled from one school to the next school to the next. We want them to be in a stable environment around a faculty that understands their needs and knows what to do in order to help them be academically successful. There are 3 pillars of support that we feel need to be in place in order for our program to be successful. The first one is preventative health screenings. The Department of Education in Louisiana requires that schools provide certain preventative health screenings on the odd years. We feel that children need preventative health screenings every year in order to identify their needs and help them get the resources that they need to be successful in school and in life. The preventative health screenings that we provide for all students at our partner schools include vision, hearing, dental, height, weight, BMI, blood pressure, and immunization reviews. We follow up those screenings with case management, where we actually do an action plan and deliver that action plan to the school and to the parents so that they know what the results are and we can get the community services necessary so that the child can get the treatment that they need when an issue is identified. Over 48% of the 4th graders that we tested for vision and hearing failed their vision screening, and 6% of them failed their hearing screening. If those needs are not identified before a February 1 deadline, they're not allowed to receive any accommodations on testing. We identified 3 children who were in the 7th grade, identified as special education, who were 3 grade levels behind. Their real issue was that they couldn't hear. They were legally deaf when we screened them for hearing, and they failed their audiology follow-up. With case management support from the foundation, we were able to get them hearing aids, and they were able to grow academically 2 full school years that year. Another year, a school requested that we do sports physicals for their sports teams. Our partners volunteered to come in on a Saturday morning and screen 60 children on sports teams so that they could participate. With just that small sample, we identified 3 children with heart murmurs and conditions where they had to be removed from the team. 2 of them had to follow up with cardiologists and are receiving treatment. 1 of them was able to rejoin the team after further follow-up. But without those physicals, something tragic really could have happened out there on the football field. 53% of Orleans Parish children are non-compliant with their vaccine schedule. One of the things that we do as a foundation with our partner schools is evaluate the immunization compliance of every child. We've been able to get compliance up to 99%, where only 1% of the students in our schools are non-compliant.
I think the biggest form of support that the foundation has been able to provide us has been through the health and wellness team. The health and wellness team meets every week. Through that team, we have been able to get nurses, We have been able to get psychiatrists, therapists, and be able to bring students who we've tried to intervene with but haven't had much success. And so after we've tried internal interventions at the school level, whether it's academic interventions or behavioral, we're then able to bring them to the health and wellness team on a weekly basis.
Our team of multidisciplinary health professionals meets with the team of academic professionals of the school to review the needs of the children that have been identified in order to build a plan around them so that they can become successful academically. According to the Office of Juvenile Justice, over 70% of children who are incarcerated have special education needs that are not identified or not being met. Our health and wellness team model is one way that we can meet those needs, and we're seeing results with that every day.
We end up seeing kids who would otherwise fall through the cracks. These are the kids that are actually struggling in the school, and we're able to then pick up on them and get them into services that they may need, mental health services, academic services, or evaluation.
These children need intensive resources that the school does not have at their disposal. They also need healthcare professionals to help them deal with the mental health issues that these children face every day in their lives, both at school and at home. Our third pillar of support consists of sustainability. We meet with the school's administrative team in order to help them apply for Medicaid to become Medicaid providers so that they can receive funding to make the programs that are provided in the school sustainable over time for the children that attend that school. When we do a needs assessment in a school, we often hear the same thing from the principals when we ask them what type of support they need. Mental health, mental health, mental health. Everything is perceived as mental health. Often what we find is that the mental health needs are actually not mental health needs at all, but are being driven by physical health needs that have not been identified or addressed.
We may see 5 different children who all present with the same type of symptoms. These children might be hyperactive, inattentive, unable to concentrate, but it's only when we do a full evaluation are we able to see what's actually causing those symptoms. That can be something like a language disorder, an anxiety disorder, early trauma, a reading disorder, or maybe ADHD. But the importance is to be able to look at it in a full evaluation procedure and be able to make sure we're looking at all the pieces and addressing the underlying causes rather than the symptoms.
When learning differences are not identified and dealt with on the front end, often the result is that the child becomes frustrated, and what began as a learning and educational need turns into behavioral and mental health needs. By being proactive on the front end, we can prevent that outcome and prevent that child becoming one of those 70% that end up incarcerated because their special education needs are not identified and treated. Obviously, we can't provide all these services alone. We partner with some of the leading educational and healthcare providers in our community. Universities that participate include Tulane University, Xavier University, the University of New Orleans, and Delgado Community College. The services that our partners provide for our children are invaluable, but what is more important is the connection and the collaboration between community resources and educational institutions and the students of the schools.
Hello, I'm Ashton J. Ryan Jr., President and CEO of First MEC Bank. I am proud to be a co-founder and board member of the Early Childhood and Family Learning Foundation. As a co-founder of an elementary charter school in Central City, New Orleans, I have seen the tremendous benefits our partnership with the Childhood and Family Learning Foundation has provided. In fact, the foundation was able to assist us in obtaining substantial funding from federal and state sources to provide high-quality health services to our students. Will you please join us in helping the foundation achieve its objectives?
Our children are our greatest resource. We hope you will continue to support the Early Childhood and Family Learning Foundation as we work together to help the children of our community succeed. For more information on our programming and how you can help, please visit our website at www.childrenarewaiting.org. Thank you.